Hello, healthcare consumers, and welcome to Gary and Jay's Healthcare Insider, the program that tries to help make healthcare easier to understand and navigate. We are committed to making healthcare personal. Today's program, Patient Safety, what all consumers need to know. In recognition of Patient Safety Awareness Week, we will focus on patient safety in today's episode. The theme this year for Patient Safety Week focuses on strengthening safety culture in healthcare settings. I'm Gary.
I'm Jay.
And we will be hosting today's program. We are not clinical people. We are experienced in the business of healthcare with over 50 years of combined experience. We bring an insider's view of how healthcare works. Our goal is to share our knowledge with consumers. My career spans managing hospital and physician revenue cycle operations that include patient admissions, pre-certification, insurance verification, billing, and medical collections.
I was the chief financial officer for several large healthcare systems. In this role, I came to understand medicine as both a profession and a business. Like any business, costs, convenience, and customer satisfaction are all very important. The healthcare business environment continues to change. Unfortunately, there are many varying vested interests in the healthcare system trying to protect the status quo that sometimes put the patient customer at risk. Our program is intended to help patients navigate these risks. So today's program, patient safety. Patient safety has seemingly become the unattainable holy grail for healthcare scholars, leaders, bureaucrats, politicians, physicians, and executives. We have come to this conclusion because of the massive resources and efforts committed to the challenge and continued significant opportunities for improvement. There is many definitions for patient safety as organizations focused on improving patient safety. For our purposes today, we'll use the World Health Organization's definition. Patient safety is the absence of preventable harm to a patient and reduction of risk of unnecessary harm associated with healthcare to an acceptable minimum. In September of 2024, Rick Pollock, the president and CEO, had an AHA press release where he stated hospitals' efforts to improve safety led to 200,000 Americans hospitalized between April 2023 and March 2024, surviving episodes of care they wouldn't have in 2019. Because of the number of proverbial cooks in the kitchen, some argue this results in numerous definitions and numerous focus areas, yearly goals and objectives, and ever-growing measurements. Or in other words, a dilution of efforts and results. This is the second time we focused our attention on patient safety because of a recent story covered by ProPublica concerning breakdowns in patient safety in a hospital in Montana. We'll save details of the story for later and start with a very brief patient safety history lesson for the uninformed healthcare consumer.
Today, medicine is held in very high regards within American culture, even after the recent COVID situation and disasters. The actual history of medicine goes back thousands of years, but we're not going to go back that far. The genesis of much of Americans' beliefs and thoughts about our healthcare system only go back as far as 1847. This marks the formation of the American Medical Association. At one time, this organization claimed the majority of physicians in the United States as their members. A significant document created upon their beginning was their Code of Ethics. The code has been revised several times since its origination. The influence continues to modern day and is a significant contributor to how medicine is thought about. Despite the AMA membership is only a minority of today's physicians, the AMA continues to exert significant lobbying power and continues to influence major healthcare legislation.
Depending upon your age, how you feel or think about healthcare might be different. For example, if you or your parents were born between 1930 and the 1950s, you might be influenced by the subtle paternalistic nature encouraged by the AMA's Code of Ethics. This is reflected in the expectation of patients' obedience to physicians' directions. It also contributed to a blind trust in the physician profession. An example of the historical relationship between physician and patient was portrayed in a 1957 revision to the Code of Ethics. This revision stated, a surgeon is obligated to disclose all facts relevant to the need and performance of the operation. Today, this is known as informed consent and plays an interesting role in the aforementioned ProPublica story and the ultimate purpose of today's program.
With this brief history, let's now turn the clock forward to more recent times. Patient safety has had a rather dubious history in the United States. In 1999, the curtains were pulled back on American healthcare system by a book, To Err is Human. The book disclosed somewhere between 44,000 and 98,000 unnecessary deaths were occurring every year in the U.S. hospitals. We found that gap of 54,000 was unusually large for a science-based industry that didn't make much sense. Essentially, little change occurred in patient safety after the book's publication. Along with 20/20 hindsight and some of our own research, we discovered the activities addressing patient safety after the book appeared to have been very episodic, random, and seemingly ineffective. Aside from the obvious, a concern within the medical community emerged that an unintended danger and consequence of the book could be a loss of confidence in the medical profession. We concluded the impact was marginal.
Ironically, as we dug deeper into the history of patient safety, we discovered a major factor impacting patient safety was the advent of the internet. You might wonder how. Until the internet and mobile devices, the patient's medical information was asymmetric. This means medical information was completely controlled by the physician and the hospital. At the time, no one completely understood how significant the impact all this would have on the democratization of medicine. The results from these findings was an explosion of resources within the government, the physician community, and healthcare organizations to upgrade patient safety, which leads us to the ProPublica story, Eat What You Kill, published December 4th, 2024, that motivated us to do this story.
This is a complex story involving many breakdowns in patient safety systems, ultimately resulting in patient harm and patients' deaths. We'll not reproduce the story here, but encourage you to go online and read it for yourself. Ironically, corresponding with the ProMedica story, a family friend was given a diagnosis potentially requiring minor surgery to remove potentially small malignant tumors her physician had been monitoring for over 15 years. Based on our friend's research and consultation with the physician, the diagnosis and recommendation for surgery were all confirmed based upon her research, except for one small detail. Before having the surgery, our friend asked her physician about having the tumors biopsied. He indicated this wasn't necessary and wasn't going to do it. Being strong-willed, she found another physician to perform the biopsies. The biopsies were done, indicated the tumors were benign, and no surgery was necessary. Great news, right? Well, she returned to her original physician, shared the good news, and was treated like a petulant adolescent ignoring parental advice. To make matters worse, while in her original physician's office, he decided to call the new physician, and fortunately, she was with a patient and didn't take the call, so he left a message, and we'll end the story there. So, in 2025, physician behavior more prevalent in the 60s is still alive and well.
This is going to be a 3-episode story. Our next segment will involve an experienced nurse to share real-life patient safety situations she's encountered. We're doing this to help build context for having a detailed resource guide to use when dealing with physicians and hospitals.
So, what's the takeaways from today? Well, number one, every consumer needs to take time to understand how patient safety affects you. The article and the discussion regarding the benign tumor is one that lends itself to the second point. Don't be afraid to ask questions regarding your condition and secure a second opinion if you feel it's appropriate. There's nothing wrong with that. Healthcare Consumer Navigator Center is your healthcare partner that offers healthcare consumers information to navigate the healthcare maze via our website. The program and takeaway information of the program will be available on our website, www.healthcareconsumernavigatorcenter.com. Our next topic will be, as Jay mentioned, the nurse will be available to discuss what her observations are and be able to make more sense out of how patient safety affects you, the consumer. This concludes our program, our first patient safety episode, and we hope the program explained patient safety and has answered some of your questions. Thanks a lot. See you the next time.